Good morning, friends. First of all, I thank the organizing committee to give me the opportunity to introduce our president, who should have been introduced last year, a year of delay because circumstances beyond our control. So, I am going to tell the biodata of Dr. Sanjay Kalra. He is a DM from All India Institute, and he is a consultant at Bharati Hospital, Karnal, and a visiting professor at AIMS, Rishikesh. He is not the immediate past president, he is going to be the president which was postponed last year. And he has been vice president of the South Asian Federation of Endocrine Societies, education editor of International Society of Endocrinology, deputy chair, advocacy and partnership working group of ISC, member of program organizing committee, International Congress of Endocrinology, Singapore 2022, section editor, endocrinology, APA textbook of medicine, section editor, tropical endocrinology, Endotech, PubMed index textbook, and he has a lot of hobbies, traditional Haryani, Mugdar and Bhangra. I didn't have the opportunity to see his Bhangra action, but I invite him to come and deliver his presidential address, which we were waiting for the last 1 year. Sanjay.
Thank you, sir.
Request Dr. Sanjay Kalra to deliver his presidential oration, which is due in 2020. Over to Professor Sanjay Kalra.
Thank you, respected chairpersons. Dear friends, it's a great pleasure having been able to serve the Endocrine Society of India. It's been a long journey in endocrinology for me, nearly 2.5 decades now. And before I begin, I'd like to acknowledge my mentor, my teacher, my guide, Professor Nikhil Tandon. I also acknowledge and appreciate the work done by Professor Raman Marwa, who helped me in my thesis. Without him, I would not have passed my exams. I thank each and every member of the Endocrine Society of India, seniors, peers, and juniors. Most of all, I thank the executive committee, led by Sujoy, who helped me fulfill my mandate as President of the Endocrine Society of India. We'll talk today about the future of endocrinology. But if we want to talk about the future, we must know about the present as well. We have had challenges, we have had our ups and downs over the past 2 years. But now we are in a position of strength. Even today, we are gathered here to celebrate a triumph. It is a triumph of science. It is a triumph of scholarship that we are able to meet face to face in person after the COVID pandemic or even during it. It is not only a triumph of science and scholarship, it is also a triumph of our system, of our society. We have worked hard to overcome the COVID pandemic. When we say society, we mean India as a whole, and we also mean the Endocrine Society of India. because it is a triumph of our fellowship and our friendship as well that we are here and we are growing from strength to strength. But even a plant needs sustenance. You need water, you need fertilizer, you need air. Otherwise, you cannot sustain your growth. And that is what the Endocrine Society of India needs as well. So over the next 20 to 30 minutes, let's talk about the past and the present of endocrinology, and then we can build a roadmap for ourselves, for the future of our subject, for the future of our society. Now, how did the pioneers of endocrinology begin? They had a mind full of curiosity. They were also mindful of curiosity, of the importance of curiosity. And all that our pioneers had was vision, touch, hearing. They could inspect, they could palpate. After some time, they could percuss and they could auscultate as well. The more daring ones of them, they used their smell and taste as well. They were able to smell ketonuria or ketoacidosis. They were able to taste glycosuria. And that is how our humble subject began. From both our respected chairpersons, I have learnt about how difficult their student days were when they worked in the animal laboratories, when they had to struggle for each and every tiny biochemical assay, what to talk of endocrine assay. From both of you, sirs, I have learnt a lot. I have learned the importance of patience, of perseverance. Because our chairpersons and their peers were patient, because they were perseverant, we have grown now. Now we are not only able to diagnose endocrine disease and to name these diseases, we are able to also perform dynamic procedures and we are able to give drug therapy, both hormonal and non-hormonal, to our patients. Things are evolving day by day actually. There is hardly a month, hardly a year when there is no new advancement in our subject. If you look at all the subjects in medicine, you will find that the maximum research is being done in psychiatry, neurology, that's one subject, oncology, which is the second. But over and above these, the maximum research is being done in endocrinology and metabolism. So that is something we are justifiably proud of. But can we survive on our own? We are talking about the future of endocrinology. Can we grow in isolation? The answer is no. Whatever growth we are experiencing today, our clinics are full, our wards are full. The service that we give to our countrymen and women and others is much better than before. This is because of, this is thanks to advances made in basic sciences, advances made in diagnostic sciences, work done by our colleagues in surgery and radiology and radiotherapy, nuclear medicine. We should be mindful of that. I do not say that we should scrape our noses before them, but we should treat them as equals. And we learn from each other. So a humble request to everybody, if we want the future of endocrinology to be bright, we need to practice interdisciplinary endocrinology. We need to reach out to our colleagues in all these subjects. It will be a two-way communication. We will enrich them, but we will also learn from them. And when I see sometimes in certain parts of our fraternity, people with a misplaced sense of academic ego, you can call it academic casteism, you can also call it academic apartheid. It hurts me. It actually hurts me. Why will you look down upon the basic scientist? It is she who has given you how to, the means to check glucose, the means to check hormones. Work with them and you will have a better future. The interdisciplinary connect is not limited just to medical sciences. What about the non-medical disciplines? Engineering. Reach out to engineering and see how much they can help you. Reach out to psychology, to mental health, and see how they enrich endocrinology. And reach out to nursing. How long will we keep on saying that endocrine nursing does not exist in India? How long will we keep on saying that diabetes nursing does not exist in our country? When will the change come? And who will bring the change? If you actually feel that you are an endocrinologist, you are God's best gift to the world, then why will you not begin? So let us begin working with these fields as equals. And then let us see the change that comes in our specialty. We need a little bit of nourishment. We need a little bit of nudging. This is part of what the presidential oration is about today. And if we are able to nourish ourselves, we are able to nudge ourselves in the right direction, certainly our specialty will get novelty, it will become stronger. One issue that we face is the lack of interdisciplinary connect. We have tried over the past 2 years to address this. But there is another aspect in India that we face. Why is it that if an Indian does very well abroad, somebody becomes the president of the American Diabetes Association, we all cheer for him. But if somebody does something novel in our country, we become jealous, we begin to criticize. Why can we not have joyfulness in our lives? Why can we not celebrate everything that is good about our country? It's just a simple question. Why can we not do that? Let's begin doing that, and then you see how joyful your life becomes. Every day becomes a day of celebration. When one of our boys is invited to the International Congress of Endocrinology to speak on a novel method of diagnosing thyroid tumors, something which will cost just 20 or 30 rupees, as opposed to the hundreds of dollars that are used in the US, we should rejoice. We should be joyful. If somebody has a new concept, if somebody publishes something new, if somebody gets invited to the editorial board of JCM, we should be joyful. And this is another humble request to all of us. Let's be joyful. Let's be always in a celebratory mood, and then see the difference that comes to our society. But all this was mere talk, and talking alone is not enough. We have to plan for the future. So while planning, let me take three aspects, three verticals, three pillars of planning. The first is education and research. The second, clinical care. And the third, advocacy and awareness. All three are equally important. Each member of the Endocrine Society of India is blessed with different strengths, with a unique strength. Someone may be good at research, another person may be very good at clinical care, and yet another person may have a very strong voice for advocacy. All are equally important. And again, if anybody is going to practice this kind of an academic apartheid or casteism, that I work in pituitary and gonad, therefore I am superior. Somebody else is working in lipidology and diabetes, therefore that person is inferior. This is not the right way to go. If somebody says, I have done original research, and that is the only good thing that can happen in India, till a certain extent you are right. You have done original research, that is a good thing for India. But it is not the only good thing. The people who are in the field, who are advocating, who are working on Facebook, on YouTube, trying to spread awareness about endocrinology, advocating for our subject, they are equally important. And we all need to work together. We speak of balanced diet. We speak of Sola Singhar. Why should we not follow the same rules, the same patterns in our practice, in our subject? We must do that. And to do that, of course, we need strength, but we also need strategy. And this is by Vidur. Vidur was one of the characters in the Mahabharata. He lived about 30 kilometers away from where I live now. And what he said was, strategy is better than strength. So let us strategize today. As ESI members, let us focus on education first. Our numbers are increasing, and we are happy for that. But we also need to maintain our quality. The entrance exams are the same now in India. So that is a very good equaling factor. Everybody comes to the same exam. The syllabi are quite uniform. Of course, the exit exams are different. But because of continued interaction that has been provided by the Endocrine Society of India, now we see a lot of democratization of our education. Through programs such as Inspire, ESI TAISA, and ESI AV Gandhi, these are annual flagship programs of the Endocrine Society of India. Our boys and girls are able to interact with each other. The young faculty is able to speak with each other. And we see that everybody is growing at the same pace. And this is a very welcome trend. It is something that did not exist 20 years ago. We have had over the past 2 years satellite symposia, thematic symposia, and so many ESI webinars. I would like to thank each and every one of you for having taken part in these. We have tried. I speak on behalf of Dr. Madhu, the president who preceded me, on behalf of Dr. Ganpati Bantwal, the president who followed me, we have tried to touch each and every member of the ESI through these programs. If there is anybody whom we have missed, it is my fault and I apologize. But if we have missed you, please reach out and we will correct that shortcoming. But we have tried to touch each and every member of our great fraternity in the past 2 years through these programs. There has been criticism about some of these programs. We are an evolving society. We are growing. We do have standard operating procedures. They are being put into place. They are also evolving. But you cannot stop working just because you do not have an SOP in place. And even if you do have an SOP in place, it may change tomorrow or day after, because the environment in which you are working may change. So our SOPs will evolve. We will continue to become better and better, but these programs will go on because they are a very good way of reaching out to each other and of ensuring democracy of education, of knowledge, of information. Now, good education, good knowledge is good for health. It is good for endocrinology. But to grow further, you need research. And our academic departments are doing a great job of endocrine research. But whatever we do has to be relevant. It has to be realistic. Of course, it must be rewarding. The Endocrine Society of India conducts fundamental research workshops. This was the brainchild of Professor Nikhil Tandon. It has continued since then. We offer research grants. I would sincerely here like to commend and thank Dr. Sujoy Ghosh for having been a great negotiator for the Endocrine Society of India. He will share his annual report tomorrow. But Dr. Sujoy, how many grants are we going to give this year now to students and to faculty and to?
20 for students, 4 for faculty.
So
and that's going to increase because every year we are now generating 80 lakhs, which is fixed earning for the system.
So this year we have given 20 grants to students and 4 to non-students. And on paper, it is an Endocrine Society of India effort, but actually it has been a Sujoy Ghosh effort. I don't think Ganpati and I would have been able to negotiate so much with our sponsors the way Sujoy has done. The Indian Journal of Endocrinology and Metabolism has also grown from strength to strength. There was a time where we were nowhere in the entire scheme of things. There was a time when we reached number 2 amongst all Indian journals. And this is another very good vehicle for us to propagate our science. So research is important. But if you look at, let us say, ExpertScape, if you look at PubMed, and then you go and see who are the best endocrine researchers from India, they are not endocrinologists. They are other people. We do not belittle their achievement. Rather, we are inspired by them. So a humble request to all of us, let us work more and more in the field of research, so that at least when someone sitting in the West Googles India, Googles endocrine research, it is one of us who should come in at number 1, 2, 3, 4. As of now, we do not exist there, right on. We are in the top bracket, but we are not at the top. We can talk about education, we can talk about research, but finally, what is our reason for existence? The reason for existence is clinical care, and we must understand that. There was a time when endocrinology was considered a very esoteric subject. I was doing DM, and I was teased mercilessly by the medicine head of department. Sir is no more now, but he used to say, why are you wasting your 2 years? Why are you doing a DM in biochemistry? Why don't you do general medicine? Nobody says that anymore now. This is not something that our young boys and girls have to hear now. I think I was lucky because at least one of our chairpersons has been told, why are you doing DM in veterinary science in Chandigarh? So at least life was better for me. But clinical care is important. And if we want to thrive, if we want to flourish as a subject, we have to be good at clinical care. We need to be competent. Your DM program teaches you that. The DNB program teaches you that. You need to be confident. That is also true. But the fact that you have passed an entrance exam and you have passed an exit exam should not make you overconfident. Unfortunately, that is what is happening. And apart from competence and confidence, you need to communicate. You need to communicate with clarity. And the endocrinologist who is humble enough to understand that communication is important for survival in life, that endocrinologist will thrive. All you need to do is to understand that medicine is not just biomedical. You are running after a TSH target or a sodium-potassium target or a glucose target, but that is not enough. You also need to focus on quality of life. You need to focus on social health. You need to focus on a person-centered approach. Simple words, but actually very difficult to put in practice. But if we can put them, if we can understand the concept of language, so beautifully articulated by Dr. Chitra, Dr. Tejal, and other friends, then you will understand that from being an esoteric subject, suddenly you get exoteric importance and exoteric relevance. And then you don't have to always keep on cribbing and crying about why endocrinology does not get its due. There should be no place for a discussion like that. Of course, we should get our due, and we will get our due. All we need is these 3 C's. Competence and confidence we have in plenty. I would admit that for all our younger boys and girls. All we need is a little bit of communication, a little bit of humility. And when you want to spread the word across society, across the population, if you are going to speak in the language of D. Groot and Harrison and Williams, then your audience is limited. People will not be able to understand. But if you're able to simplify things, if you're able to talk about endocrine hygiene, metabolic hygiene, glycemic hygiene, just make endocrine health a part of hygiene, then we will be accepted. So this is again something for us to ponder over. How can we talk about the future of endocrinology if we do not talk about clinical care? And when we are talking about clinical care, the person who is the center of gravity is not us. It is the person who is seeking clinical care from us. It is the patient with endocrine disease. We've spoken of education, research. We've talked about clinical care. Advocacy and awareness are important. And again, our chairpersons have been at the forefront of this. Arouse interest in the community around you. Address topics of interest and advocate for action, and then augment it, enhance it. And then again, efforts from the Endocrine Society of India, from our younger fraternity. They have focused on wellness endocrinology, making endocrine health a part of wellness. They have focused on endocrine awareness. These have actually helped our cause. India is a strong and active participant in the South Asian Federation of Endocrine Societies and in the International Society of Endocrinology. This too has helped us. It has strengthened us. It has helped us build bonds and bridges with our neighboring countries far and beyond. In fact, for today's presidential oration, one of the things which I got to know was from Dr. Joel Tilak Singh, who is an endocrinologist in Trinidad and Tobago, the other end of the world. And he helped me prepare my oration for today. So what he taught me was that, again from the Mahabharata, princes who live in palaces and plants that grow in parks are doomed to stunted growth. If we want endocrinology to flourish and grow, if we want a bright future for ourselves, we have to go out of our palaces. We have to go out of our parks. We have to go out of our comfort zone and deal with the people for whom we live. That is the men and women of India, the boys and girls of India. To do this, we need to expand our horizons. We need to think beyond boundaries. While expanding ourselves, while going beyond boundaries, we need to ensure that our core remains strong. A simple take-home message for all of us. First, focus on your thoughts. Make your thoughts strong and positive. If you get negative thoughts in your mind, try to stem them there and then. Between your thoughts and your words, give a few seconds of censorship, self-censorship. Once your thoughts are positive, automatically you will speak positive words. And when you speak positive words, positive actions will come out of that. So again, a request to everybody, focus on your thoughts. Always be positive. If your thoughts are positive, automatically your words and actions will become positive. And then the end result will also be positive. Be aware of what is going on around you. Endocrinology will remain forever and ever, but seize the moment. If there is a sudden challenge, then you address that. Now, COVID was an obstacle to global health, but you can view COVID as an opportunity for endocrine health as well. So we use the words glucovigilance. When you are trying to prevent COVID, when you're trying to manage COVID, be vigilant for glucose control. We also use the word glycemic hygiene. The same way you would focus on personal and social hygiene, immune hygiene, nutritional hygiene. Why not focus on glycemic hygiene? Make glucose control part and parcel of your day-to-day life. Once that is accepted by the community, then the next sentence is, the endocrinologist, your friendly neighborhood endocrinologist, is best placed to offer this hygiene to you. So seize the moment. Dr. Rakesh Sahai spearheaded the concept of steroid stewardship. Now we talk of antibiotic stewardship, but why can we not talk of steroid stewardship? And if you are able to introduce the concept of steroid stewardship, then who is best placed to offer that? The clinical pharmacologist, the rheumatologist, the RMP? Maybe. But the endocrinologist has an equal say. So this is how you are able to bring your subject to the center table, to the high table of public thinking, of public discourse. Diabetic lung was coined by Dr. Shaila Sheikh. So much to do. You can spend 3 hours discussing it. You can have a full essay-con on diabetic lung and the topics will not finish. So this is how you have to seize the moment. While you're doing that, do not forget topics that are unique to India. I was so happy today to hear Dr. Arpan, Dr. Vagesh, and I know that the people behind the scenes are Dr. Ganpati, Dr. Prasanna Kumar sir, Dr. Surya Narayanan. When they say, we are 50 years old, why can we not stand on our own feet? Of course we should. And if we do not do research on steroid stewardship or tropical endocrinology or infections and endocrinology or tuberculosis, then who else will? So these are things to bring to the table. Dr. Arpan mentioned sarcopenia. Dr. Jubin Jacob will present a definition of sarcopenia coined by South Asia. Why is it that only Westerners can coin a definition for polycystic ovary syndrome or for metabolic syndrome? Why can Jubin and Nitin Kapoor not do that? And when they do it, when Jubin presents his case, then I would request you, let's be joyful, let's celebrate, because the definition has come from our persons, from our fraternity. While on this, teamwork is important, and you must have seen over the past 2 years, if we believe in teamwork, that is our thought. If we speak of teamwork, those are our words, then actually teamwork kicks into action. And when you teach about concepts like glucocrinology or lipocrinology, you are actually enhancing the spectrum or the canvas of endocrinology. You are telling the general public that these are endocrine subjects, this is endocrine domain, and you will find that our subject will grow further. In the past few months, we have focused on barocrinology and also geriatric endocrinology, though I must admit that there was a selfish motive here. The point is, sir, that I am going to be 60 in a few years from now. So I thought that it would be a good idea to train everybody in geriatric endocrinology so that they can take good care of me after 8 years. Also, I keep on struggling with my weight. So again, I thought it would be a good idea to put some sense, to drill some sense into the younger people so that maybe in a few years from now, they will be able to make my weight healthier. So this was the selfish motive behind these 2 subjects. Other things have also come in. And we see from Ramaiah Medical College, from Chennai, Dr. Pramila Kalra is here. Transgender endocrinology is finding its due place. Dr. Vaishali Deshmukh has spearheaded the concept of mind-body medicine and endocrinology. She is the first person in the world to do that. So how should we respond? With joy, with celebration. And if you are joyful, automatically something called glycemic happiness will enter your OPD, your chamber, your ward, your ICU. Not to forget the other difficult things like endocrine biochemistry. But if at all I need a lecture on HbA1c and glucose, then I look up to Sujoy to teach me the basics. And nutrivigilance. We spoke of psychology and endocrine nursing. Do not forget nutrition They are also equal partners in our aim for good glucose control, good endocrine control. But if there was one single fraternity that I would request us all to reach out to, that would be the patient. Because we live for our patients. That is why we have become endocrinologists. Speak with your patients the way your patients wish to be spoken with. So when we speak of good glucose control during Ramadan, during Hajj, it is because we are concerned about our patients. We understand what they want and we are trying to give them the best. When we speak of the Bhagavad Gita as a means of understanding how to motivate a patient to practice good self-care and self-management, the denominator is not the Bhagavad Gita. That is a tool. The end recipient is the patient who believes in the Bhagavad Gita. Nowhere do we say that everybody must read the Gita. If an article was written, it was written with the sense that if you have a patient who believes in the Gita, then this is the way you can counsel your patient. If you feel that you are an excellent endocrinologist and you do not need to counsel your patient, so be it. We wish you all the best. But if you have even one patient out of 1,000 who is transgender, even one patient out of 1,000,000 who is a Baha'i, one patient out of 10 million who believes in the Gita, then as a good endocrinologist, you should be able to address that patient's requirements. When I was president and before that, I have been told that the Bhagavad Gita is equal to Tintin. We accept that because from the Tintin also, you can understand what hypogonadotropic hypogonadism is. You can learn about alcoholic liver disease, even Wernicke's encephalopathy. So Tintin is equally inspiring for me as an endocrinologist as the Bhagavad Gita is. But I do feel surprised sometimes. Why is it that when I use the book of Job to teach hybrid diabetes, to teach 1.5 diabetes, type 1.5 diabetes, I am praised. If I help somebody focus on Ramadan or Hajj, then I get bouquets. But if I talk about Bhagavad Gita and motivation for good diabetes care, then I am trolled. I have still not been able to understand it, but I guess that is part of evolution. Maybe another few years from now, I will be able to understand. But until then, let me leave you with these thoughts. Communication and collaboration. These are the two things that are essential for us if we want the future of endocrinology to be bright. How can we communicate and collaborate? By being with each other. Kleber's law is a law from biology. Kleber's law has been used in urban landscapes as well. So have you ever thought why there is Silicon Valley in the USA? Why is Bangalore an IT hub? When actually you can connect with each other on Zoom, but still Bangalore is our IT hub. The reason is Kleber's law has been used to say that if people get together, the more the people, the more the number of thoughts. So if there is one person, there will be one thought. If there are two people, there will not be two thoughts. It will be 2 into the power 1.75. So the more the number of people, the more the number of thoughts, idea generation. That is what we are achieving in ESICON today, Bangalore. That is why the organizing committee worked so hard to make sure it is a physical meeting. And the West uses Kleber's law, but in India, we have more wisdom. We use these simple numbers. If 2 of us get together, the power will be, it will not be 2, it will be 11. And if 3 of us get together, it will be 111. That is what we are achieving today. And I would like to thank the Karnataka Endocrine Society for having made this possible for us. In fact, the Karnataka Endocrine Society deserves even more thanks because they have done I don't know where Dr. Arpan is, but even before I became president, the hand-holding had begun. And I would like to thank everybody in Karnataka for having made me feel part of the family. This is our society, the Endocrine Society of India. I am a proud member. If God gave me 7 lives, I would always want to be an endocrinologist. I would want to join the Endocrine Society of India. I would live happily ever after in India. I would never think of migrating abroad. I would work with people from abroad. I would reach out to SAFIs and ISC as an equal. I would not reach out in a paternalistic or big brother mode. I would reach out as equals, even to Afghanistan and Maldives. But I would also reach out as an equal to the United Kingdom and USA. Our self-esteem, our self-prestige will always remain intact. It is not haughtiness or pride. It is just about self-esteem. And that is why the choice of speakers of our Bangalore team is great. This is our logo. Has anybody thought who wrote this logo? It was written in 1971. I did not write, Ganpati did not write. What does this logo say and where does it come from? It comes from the Bhagavad Gita, chapter 18, Shlok 46. This is what it says. I myself do not know Sanskrit, but it says, Yen Sarva Idam Tatam, from whom all living entities have come into being. It is a divine power. You can give whatever name you wish to it. But this is what pervades us. This is what keeps us going. It is a divine power. This is what keeps the Endocrine Society of India going. And our founders, in their wisdom, thought it right to respect this divine power. See the full shlok in front of you. By such performance of work, a person easily attains perfection. Which work? Our natural occupation, that of endocrinology. Endocrinology including education, research, clinical care, advocacy and awareness. This is our natural work. If we perform it and we continue to perform it with diligence, we will attain perfection. Again, I mentioned just a few minutes ago, I was trolled. Let us move fast forward, and this is to about 130 years ago, when this simple but courageous lady came from England to Ludhiana, to my alma mater, Dame Edith Brown. And this was her motto: my work is for a king. This is my work. As President of the Endocrine Society of India, I have tried to work for a king. My king has been all the members of the ESI. I have tried my best. There may have been shortcomings. I apologize for that. But I am confident that our future is bright. We have able leadership, we have perfect mentors, and we have a wonderful fraternity. All the boys and girls of the Endocrine Society of India, I feel so happy when I see you growing. I feel so happy when I see the Endocrine Society of India growing. Keep this in your memory. This woodwork comes from Jubin Jacobs' clinic, and thanks to him for sharing it with us. Again, my work is for a king. When you're here at Essicon Bangalore, think as if you are working for a king, a higher power. When you're in your clinic, in your ward, maybe you're taking rounds in the ICU. Again, think that you are working for a king, and that king has come to you in the guise of a patient. If you can work for that king, then certainly our future will be bright. Jai Hind, Jai ESI.
Sanjay Kalra for an excellent oration. As usual, tradition, no questions. I would like to thank the organizers for giving me and Dr. Muralidharan an opportunity. I should say one thing. I have seen Endocrine Society at least first meeting 1985 onwards. Every year we had one annual conference, at the most one mid-conference. What we have done 35 years, I was also president. Within 1 year, Sanjay Kalra has done more than the conferences what we have done 35 years, whether video, this one or virtual conferences. Thank you for your excellent leadership, and you have led us for 1 year, and I hope the future president also will lead us like this from the front. Thank you once again.